Most people fear amputation, but what truly happens after surgery will surprise you. Today I'm going to talk about the topic how I rehabilitated an amputee. So let's start by defining amputation. Amputation is the removal of a limb. It can be whole or part of a limb. So it is the surgical removal of a limb. That is what we call amputation. And usually amputation is done when it is considered to be the best option, which means that amputation cannot be done as the first choice in any condition before other measures have been considered. So usually the patient is evaluated, the best modalities are put into place, and then after all the modalities have been rejected, that is when amputation should be considered to be the best option for the patient. So what causes amputation? Amputation has several causes, including trauma. Under trauma, we have things like road traffic accidents, we have industrial injuries, we have fractures, and then we have burns. So there are certain burns that cause amputation. For example, if it goes beyond 40-degree burns. Then under fractures, there are certain fractures like open fractures that sometimes have no better prognosis with surgery. So the best option usually is amputation. Then another one is industrial injuries. Usually occurs in people work in companies. Then road traffic accidents. This occurs especially if the body part has been severely damaged. So those are the causes of amputation under trauma. Then we have the vascular causes. This is where we have things like diabetes. Now diabetes usually is the major cause of amputation in patients who are not involved in accidents. This occurs usually in the foot. Usually it starts in the lower limb. So that is where amputation usually occurs in diabetic patients. Then we have frostbite, usually in patients who have stayed in prolonged cold and the foot has started to rot. Then we have arteriosclerosis. So those are the vascular causes of amputation. Then we have infections in diseases like leprosy. We have filariasis and gangrene. Gangrene basically means the foot has been dead. There is no blood supply, no venous return, and there is impaired nerve transmission, which means there is no motor sensation, there is no sensory sensation. Usually occurs in the foot, gangrene, and mostly in the diabetic patients. So those are the infectious causes of amputation: leprosy, we have filariasis, and gangrene. Then we have tumors. Tumors usually bone tumors like osteosarcoma. Then we have soft tissue tumors. So amputation usually is done when it is considered the best option in tumors to avoid the spread. Usually done before it reaches stage 3 and 4. Then we have congenital limb deficiency. So those are the causes of amputation. Number 1, we have trauma. Number 2, vascular causes. Number 3, infections. Number 4, tumors. And number 5, congenital limb deficiencies. So why should amputation considered? And if it is considered, what should it achieve? Number 1, the most distal level with the clinical condition, which means the point basically means that if amputation is to be done, especially on the lower limb, it should be done on the lowest point of the clinical condition. So it should not be done higher away from the clinical condition. For example, if you have gangrene of the big toe, so usually it should involve the removal of the big toe, not the whole foot. So that is what the point means. Then it should provide a well-healed stump. Then it should provide less functional loss, which means that After amputation is done, the patient should be able to continue with their functional activities. It should not take away much of their functional capacity. Then less energy for amputation with prosthesis. So prosthesis is basically these are devices that are given to patients after amputation. So after amputation is done, they should be able to use less energy for ambulation. They should be able to use less energy for movement while doing their daily activities with the prosthesis that is given to them. So let's look at the post-operative care after amputation. So number one, we have stump maintenance. So let's define a stump. So a stump is the residual limb that remains after amputation, the body part that remains after amputation has been done. And usually we have what we call an ideal or a good stump. So it is usually defined by having a proper length, proper shape, then the skin should be free, there should be no phantom sensation or pain, there should be no neuroma, then it should have a relatively good range of motion, then a good muscle power. So that is what defines an ideal or a good stump. So let's look at stump maintenance. So we have number one, what soft dressing, then number two, rigid dressing, then number three, crepe bandaging. Crepe bandaging is usually done in the form of the figure of 8. Then we have controlled environment method, and then immediate post-operative fitting. So this is usually can be done in the theater immediately after surgery. So let's look at the post-operative program in the amputee training. Let's look at the program that I implemented on the patient immediately after surgery was done. So on day one, there was breathing exercises. This usually helps since the patient was put under anesthesia during surgery, and it also helps with the relaxation of the patients, and it helps in proper use of the breathing muscles. So number one, breathing exercises. Then number two, proper positioning of the stump or the limb. So it should be properly positioned after amputation to enable good movement of the blood, that is venous return and arterial supply. This also prevents things like edema and neuroma. So proper positioning of the limb and the stump. Then we have what we call stump wrapping. Stump wrapping usually starts, especially if the patient amputation was done in the form of a closed amputation, if it was not open. So you immediately begins stump wrapping, usually done in the form of figure 8. So this helps in preventing hematoma and also in stump shaping, which is proper for a good prosthetic fitting. Then on day 2, we began sit-up exercises in bed. So this is whereby we now start moving the patient out of bed to start what we call the sit to stand exercises. So this can be done in the form of a walker, but there is no movement still. So they sit, they stand, they sit, they stand. This helps in their posture training and their balance training. Then we have breathing exercises. We continue with that. Then we have mirror therapy. So mirror therapy helps in the biofeedback, whereby we place a mirror in front of the patient. With that mirror, they can be able to visualize their limbs. So this helps in the prevention of things like phantom sensation. They still feel the amputated part of the limb, and sometimes it is accompanied by pain. So that's why we do the mirror therapy. Then we continue with stump wrapping. Then if the patient is able to do all these, we can start gait training on the second day. Then on the third day, the drain is removed. So on the third day, we have drain removal and stump exercises. So this is whereby we start engaging the stump in the range of motion exercises and also in the strengthening and stretching exercises. So stump exercises, and I said that the stump is the residual part of a limb that remains after amputation. Then on the fourth day, the patient can now stand with or without support. This is after we have done proper mirror therapy and proper stump wrapping. They begin standing with or without support, and then they begin gait training. Gait training can be done in the form of a crutch. There are patients where we use crutches, there are patients where we use a walker. So gait training in the form of crutches and walker. So that is the fourth day. Then day 5 to day 7, the sutures are removed. So the sutures are removed and the stump bandaging is done. This is whereby we now start doing an intense rehab. So we'll do an activity that comprises all the rehabilitation techniques, which include: one, we have stump wrapping. Stump wrapping usually continues even after day 7. So it should be done and the patient should be taught on how to do the stump wrapping in the form of figure 8. Then mirror therapy is also continued, just to awaken the brain that the sensation that they feel on the missing part of the limb is not real. Then they continue with the gait training just to ensure that everything is perfect. Then they continue with the sit to stand exercises and then balance exercises. Then we have what we call the pre-prosthetic training. So this is whereby we train the patient before the prosthetic is fitted. So this phase plays a major role in the successful outcome of the prosthetic fitting and usage, and it usually involves the following activities. Number 1, we have active range of motion exercises. So this is whereby the patient can now do the exercises on their own. Then we have proper positioning, whereby the patient now positions the limb in a proper manner. Usually they elevate the limb while sleeping or while sitting at times to avoid edema and hematoma on the stump. Then you have proper skin care. The skin should be taken care of and avoid any injuries at that point, especially in diabetic patients. Then you have muscle strength training. This whereby the muscle power is improved through proper exercises. Then we have crutch or gait training. So this is included in this phase as the patient now goes to the point of receiving the prosthesis. So they should be able to use the crutches or the walkers in a proper manner before they receive the prosthesis. Then you have patient and family education. And if they use the wheelchair, they're trained on wheelchair mobility and also self-care. So that is what the pre-prosthetic training phase involves, and it helps in the proper fitting and usage of the prosthesis. So after that, the patient now begins what is known as prosthetic training, and this usually involves a multidisciplinary approach, including the physical therapist, occupational therapist, and the prosthetist. So this usually ensures proper outcome of the prosthesis, whereby they are trained on the donning. Donning is the putting on of the prosthesis, and doffing, which is the removal of the prosthesis. So as you can see, amputation is not the end, but the beginning of a new powerful chapter of recovery.